Have you ever wondered what integrative medicine is? Well, today on Insights with Entrepreneurs, we're going to be meeting with Dr. Jeff Shad of Minimal Invasive Medical Group, where he's going to talk about how chiropractic, physical therapy, orthopedics, neurology, and many other subjects work with the whole human body. So let's go in and meet with Dr. Shad. Hi, Dr. Shad.
Hey.
Welcome
Janice,
to
nice
Insights
to have you.
with Entrepreneurs.
Thank you.
Let's go back and talk about your minimally invasive medical group and what exciting things they're doing.
Thank you. Come on.
Okay. Well, Dr. Shad, welcome to Insights with Entrepreneurs. I'm excited to talk about your business that you have in Orange County at 3 different locations.
Yes, thank you for having me.
Yes, I know you're located, right now we're in Irvine. You have 2 other locations, one in Lake Forest and one in Mission Viejo.
Correct.
Okay.
That's right.
Well, let's first talk about how did you become a chiropractor? I know you started your education at Pierce College in Woodland Hills.
Yeah, so I migrated here when I was 14 years old from Germany. By the time I learned the language, was my 9th grade, 10th grade. I was able to finish all my prerequisite in high school. Didn't have any more math or science or physics, anything left. 11th and 12th grade, I started college and high school. I ended up at Pierce College. I didn't know what I'm going to become at that moment. So I just started taking the general prerequisite. And that's how I ended up in Pierce. And then after I graduated from high school, I continued at Pierce for a few years. Then as I was going through what I want to do as a profession, what I like to do, I wanted to become an orthopedic surgeon first. Then I had to take the MCAT. A friend of mine, he was like mentor. He was older than me, bodybuilder, Persian gentleman, very nice guy. He's like, I heard that you're very good with your hand. You're very handy. And, my cousin, his cousin at that time, is a chiropractor. And you should go check out his practice. It's in Santa Monica, blah, blah, blah.
Yeah.
Right after that, I got the person's information. I ended up at his chiropractor office. I saw, wow, what an elaborate setting. His patients were all happy. They loved him. They hugged him. Like it was such an intimate relationship between him and his patient. That environment caught me. I'm like, wow. And all healing profession. It's all with hands. It's all with consultation about your nutrition, lifestyle, and so on and so forth. You're a doctor of chiropractic, so we really work on holistic approach. It touched me versus doing surgery. And although I had, all the prerequisite requirement to do what I have to do as a surgeon, if I wanted to become one, I chose to go seek information about chiropractic at LACC, Los Angeles College of Chiropractic. Mm-hmm. And currently it's in Whittier. It's one of the best colleges for 4-year graduate school. Checked out the prerequisite for chiropractic, went to Western University and finished the accelerated program on science, biology, biochemistry, so on and so forth, physiology. I took a 2-year crash course in 6 months period. So I was able to get into chiropractic school at the age of 20, almost 21, barely, almost 21. Okay. And I graduated right before I was 25. So I was one of the youngest ever graduated from chiropractic college in the United States of America.
Oh my God, congrats.
I think I still hold the record.
Yeah.
because that's how I started chiropractic.
Okay. So how did you go? You were out in the San Fernando Valley.
Right.
And then you here in Orange County. So,
right.
And you started your first business, your first practice in around 1994. 94,
yeah.
Okay.
Right after I graduated, almost right before I graduated from chiropractic college, I found a space in Garden Grove. I speak German and Farsi and English. I understand a little bit of Turkish and a little bit of Arabic. So I'm fluent in 3, understand 5 languages. The owner of the building was German, and we clicked. I started speaking German to him, and he fell in love with me, and I made a deal with him, 6 months free rent, another 6 months for $500 a month.
Oh my goodness.
So I got, the place it was a chiropractic office, vacant. Mm-hmm. Actually had some equipment. The guy kind of left it I don't know what happened to the previous chiropractor there. And he left the X-ray unit behind. So I kind of got it half furnished for $6,000 for the first year. So it was like steal.
Very good. So you started your first practice in Garden Grove. And then
from
then
there,
you found yourself in Irvine.
No, and then I find myself, then I went to Costa Mesa.
Costa Mesa.
Opened a second office. I had a orthopedic surgeon who was coming to my office, seeing some of our patients every other week, and then became every week, and then we became friends. And he wanted to open a surgery center, and I didn't know anything about surgery center. I'm 2 years into practice at that time, and he found a place in Huntington Beach. So then he asked me if I want to help him, if I want to be his partner, and we became partners in endeavor. I took over after being an administrator and a chief operating officer of that surgical center. At that time, the law didn't require to be accredited. 6 months after we opened, the new law came, AB 595, that required the surgery centers to be a freestanding, accredited or licensed by state of California, certified by Medicare or an accreditation agency.
Okay.
So I took that task on without knowing anything about it. And I did a pretty good job. I got it passed. So that was our first surgery center with the orthopedic surgeon. I became his partner. I had 2 clinics at that time. Mind you, I'm only 27 at that time.
Well, that's very good because you're doing something. You started out, you became a CEO of orthopedic business with your chiropractic. So that's like integrated type medicine.
Exactly. It's integrated medicine, multi-specialty. That got me excited because remember I said I wanted to be an orthopedic surgeon.
Yeah.
So I kind of found a passion. I'm like, oh, great. So now I have orthopedic surgeon as a partner. I like orthopedic cases. I'm very good at spine and I'm very good with my hand. So if I try to treat my patient, 9 out of 10 patients got better without surgery, without any medication. There's one always that needed some sort of intervention, surgical intervention. And I recommended my partner at that time, and then they got more doctors involved. So we became integrated, multi-specialty, doctors for spine, extremities, yada, yada. It just kept expanding into pain management, neurosurgery, cosmetic surgery. It just evolved.
I mean, it's evolved. I'm here in this room right now, which is actually a small gym for physical therapy.
Right.
So only you're doing chiropractic, you're doing physical therapy.
Right. So that's another part of our integrated medicine that we are promoting. So minimally invasive medical group, I picked that name because it's whatever procedures they do surgically is minimally invasive. I could say almost non-invasive, using small holes, cameras, microscopes, so on and so forth. Catheters, very, very small incisions, so less trauma to the patient. The other department we have is holistic chiropractic. And then next to it, we have to have rehabilitation and physical therapy, which we see here. So again, integrated type of medicine. We work together with physical therapists, doctor of physical therapy. Here in this gym, they use the gym to rehabilitate the patients after the initial treatment with chiropractic, or they could come directly to PT. Depends what conditions they have. We customize the protocol to patient's need. It's not always chiropractic. So I don't force one line of treatment. Whatever fits your situation is what I prescribe.
I love what you just said. You customize.
Yes.
Because I look at each individual as being a unique.
Exactly.
A unique person. I want to say unit, but I don't think unit's a correct word. Each of us is different.
Everyone has their own genetic. Everyone is formed. Although we all human, we all evolve. We all form the same way. All cells are pretty much replicating, dividing, and constantly renewing themselves. And but every individual could have a different perception for pain. Some patients could have thyroid issues and they feel more pain. Some patients are deficient on vitamin D, vitamin B. They're nervous. They could have fibromyalgia. So if you look at the patient and you try to use one method for every individual, you might be too sensitive to acupressure. Like if I start doing a lot of acupressure on your shoulders, back,
Right.
if you have fibromyalgia, you can't tolerate it. But then another therapist I have here does active release technique or does some mild exercises specifically for your condition. That individual, like you said, that specific person.
Yeah, because I find that I talk to people, and some people will just, they eat everything.
Yeah.
And we're going to talk on another show about eating, okay?
Nutrition is very important.
And how you eat. Or maybe one person never gets up off the couch and somebody else may jog 10 miles a day.
Right.
So, I mean, and your work, what type of work you've done.
You look at the individual systems, right? So every individual comes in, they come in with some kind of a symptom. This is what's your chief complaint when they come in? Like, what is bothering you? And they start by giving me, normally they give me 20 years up to 30 years. When I was 18 years old, I fell off the horse. When I was 20, I got hit from, really hard from behind. I don't know. They all have their stories. So something has initiated that injured body part. And in their mind, a lot of times they're stuck on that incident. To me, at that moment, I listen to it, but I then look at their body and I look at what would be ideal weight for them. That's the first thing. I don't even tell them. Well, as soon as I look at you, and as a patient, I'm looking at you from head to toe. You're talking about your disc herniation in your low back, and I'm looking at your MRIs, and they're saying it's 3 millimeter, 4 millimeter, and I'm looking saying that's not what's causing his pain. Because I see patients up to 12, 16 millimeters. I know the characteristic of a discogenic pain, but that patient is stuck on that mode. So I have to work on their psyche. I have to work on their nutrition. They're overweight. I have to work on what kind of work they do. How often do they sit? How long do they sit? Do they get up and take a break? Are they ergonomically correct at work? We slowly get into the entire body as a whole. That's why the multi-specialty clinic works great for my patients, because I'm become their gatekeeper.
So do you see each patient and do an intake and then refer them to the other
as much as I can?
Sections?
As much as I can. But of course, every doctor is independent contractor here, and they have their own patient flow. But once they get stuck or they need my opinion, I do get involved. Majority of the time, the answer is yes. I do see most of the patients that enter the chiropractic and physical therapy clinic. I'm the clinical director, so I do see them, almost every one of them, and kind of assess their case, review their records, and shed some light on their condition and give them advice.
Because I noticed when I was reading about the other staff people that you had, especially the professional staff that are doing the medical part of it, okay? They all have some really interesting, unique backgrounds.
Right.
So you're being able to put this unique clinic together.
Exactly. Yeah, what I do is I interview pretty much every one of these doctors that join the practice. Of course, we do have a medical director who oversees all the medical services, because this is a medical corporation, it's a medical group. It has to be medically directed by a group of physicians. And being a chiropractic physician, a non-medical physician, I stick to advices to the patient, and I'll see what background these doctors are coming from, and I share my philosophy with them. And often they blend and they match my philosophy. But if they don't match my philosophy, kindly I find a way to go to the next physician that I think is best fit in this environment. So, so I do, in a way, interview the doctors.
Well, to
certain degrees.
Because of the type of practice you have and medical group it has, you want to be working with people who are like-minded.
Exactly.
Like-minded. And I know interviewing people is not easy.
No. And then a lot of them come in with their own ego on their shoulder. And but I find eventually I find a pacifier to pacify the physician in the right way, in a good way. So give them a good environment. Physicians are busy. They're treating some complicated cases, especially surgeons. They're surgeons. They just need to, you come in, you have a blown disc. All he's thinking about is, this is what I could do surgically. He doesn't have the time, like me, to talk to you about all the non-surgical remedies, what you could do as far as nutrition, what kind of a lifestyle change you have to do to address it if you don't want surgery, or even if you have surgery. So yeah, so it's a very challenging job that I have, but I love it. This is what
I can tell you love it. I can hear it. I can see it in your eyes, and I can see it in your smile. Okay.
Thank you.
That you love what you're doing, and you're out to make sure that your patients' lives are better
Yes.
when they walk out your door than they were when they walked in.
Exactly. And I use my own lifestyle, my own life as an example often for them. I show them an MRI. I have it all. I have the MRI block, where the name is. And sometimes they come in with small disc herniation or something that is insignificant in my eye. And I say, hold on for a second. Let me show you something. And I show them the MRI. And I said, who do you think this MRI belongs to? And they're like, oh my God, that looks bad. I'm like, this person is working out every day an hour, goes four-wheel driving, plays with his kids often. Yeah, maybe he doesn't run 10 miles a day, but he's very active and he's in shape. And they go, oh, there's no way. What did you do for him? I said, well, that person is me. You're looking at me. And I try to keep fit all the time. I try to keep my ideal weight. So I walk to talk. And they see an example in front of them. They go, wow. And although my hair is turning gray, but often they can't guess my age. But now that I'm getting all kinds of gray hair, it's easy to guess. But but when I was like 45, they thought I was 35 or 32. So that's what I do. I inspire them. I excite them. Sometimes they forget about their pain. It's very interesting how psychologically I could make them turn around. And they're like, wait, we didn't even do treatment yet. I'm like, yeah, how you feel? They're like, oh, I feel better.
I like that you're looking at treatments that are not so aggressive, like
Exactly.
going in and doing a surgery with. So
Right.
I'll use knee surgery, which is not one of the easier things to recuperate from.
Yeah,
But you're
well,
going to
depends
try.
what type of knee surgery you're talking about. But yeah, if you're doing a knee replacement, it takes anywhere between 2 to 6 months to recover, sometimes more.
I could tell you
'cause you-
personally that it takes more. Okay.
Yeah, depends what age you do it too. So we could get there whenever on the next show or this show, whatever show you
Well,
want.
on another show, we'll definitely talk about that more. But for this show, it's like, so you have an actual surgical center.
Right. Yeah. So me and my wife, I have to give the credit to my other half because she, it's not easy to be my partner because I'm very busy, active mind, active life. She keeps me on my toes. And she keeps me in the right direction. And she's our CEO of the surgery center. So I made her the CEO, meaning I can't do everything by myself. So she helps me run the surgery center with the help of our director of nursing and our administrator. They're both very close to me and my wife. So yeah, it's a team effort. Yes, we run that center. It's a multi-specialty surgery center in Lake Forest attached to our clinic. And we do all kinds of minimally invasive procedures.
So do your doctors have any practicing rights at any of the local hospitals that they have to do something more than your center?
Right. So we are a outpatient surgery center, meaning that's what they call an ambulatory surgical center. So you could ambulate on your own into the center and walk out. So more complicated cases, the ones that might require overnight stay. Actually, we do have 23-hour stay. By law, we could keep them up to 23 hours. And we've done so on some of the bigger cases that we do. Like, let's say, lumbar disc replacement, like you replace your disc in your lower back. Those, because they go from the front, we do about a couple of those a year on a younger patient. It's a better environment for them to do the surgery than hospital. But these doctors have privileges. Most of our doctors are either chief of staff or medical staff or Mission, Saddleback, Hoag.
Okay.
Yeah, so we work with pretty much the three major hospitals.
So do you see any more growth going on in your practice?
Yeah, I mean, we just opened the first outpatient interventional radiology center, which in my opinion is going to be the next urgent care center. Probably in 3 to 5 years, you're going to see them pop up everywhere. It's called the IR Center,
Okay.
Interventional Radiology. And people don't understand. They're like, wait, radiology, I thought was x-rays, right? So what these guys do, they're trained physicians using imaging guidance procedures. So they use a CT scan. They use a C-arm with the 3D images. They use MRIs, ultrasonic imaging to enter through your blood vessels, enter your body, and do direct treatment. For example, one of the treatment they do is Y90. They go through blood vessel to the cancerous tissue in your liver, and they inject radiation material around the cancer cell, and they melt the cell through your own pathway to the cell. So they find the cell with CT scan, and while they're in the operating room, they're using live images, guiding their catheter, the little wire, get it close to the cancer cell, the cancer, I would say, cyst. In a way, I want
Right.
the audience to understand. I'm trying to use a layman's term. So that way, and then they radiate it. And sometimes they find the hemorrhoid that way, and they embolize the hemorrhoid. They kill the blood flow to the hemorrhoid internally through your blood vessel. No cut, no incisions, and the hemorrhoid will shrink. And they also started doing that for knee arthritis. They do that for frozen shoulders. There's so many different procedures these IR doctors do. Currently, they do mainly in the hospital.
Is that like using more robotic type surgeries?
It's not robotic, it's a catheter. So
Just a catheter.
Consider it like a wire.
Okay.
They put the wire through your blood vessel, and they're watching which direction is going.
Okay.
And they find the pathway, the way to that illness or that cyst or the hemorrhoid. They
Okay.
find the pathway there, and they stop the blood flow, or they slow down the blood flow so it stops growing, or stops the inflammation, or it stops the adhesion in the frozen shoulder. So that's the next step. That's what we've done. We're probably one of the first IR center in Orange County.
Very good. This has been very interesting.
So entrepreneur is my name for sure.
You are definitely an entrepreneur, okay? I know we have some other shows scheduled for the future. I'm looking forward to them, where we're going to be talking about more of the type of procedures that your minimally invasive medical group does. Dr. Shad, thank you for coming on with all your energy and your love of what you're doing and how you're bringing different things to the Orange County area. One of the things I like to always say to anybody who watches our show is, if you have any questions that you want to bring to Dr. Shad, or especially myself medically, I cannot answer any of these questions. Please, we love comments. You can find us on many different outlets, YouTube, Facebook, anything where we can take the comments from you. We love to have them, and I know Dr. Shad would love to answer any comments about his medical group. But please come back and join us again. We loved having you on Insights with Entrepreneurs and finding out what a great entrepreneur you are, and how you enjoying watching your business grow and helping people at the same time.
Yes, that's the goal.
That's
Thank you for having me.
And we will see you very soon on Insights with Entrepreneurs. Thank you.